Vicsik, and I'm the Florida Executive Director for Enroll America.
What's happening today? Where are we, and why are you here?
So we have a NAB lab here at the Marshall Center. This is actually a recurring event, and we do it for students and also just the general public to come in, talk to a healthcare navigator about their healthcare options so they can find a healthcare plan to enroll in that works best for them.
And some of the healthcare plans, I assume, are through the Affordable Care Act, but that's in limbo right now. It sounds like the Republicans want to repeal it and maybe replace it with something. How is that affecting enrollment, and what are people saying about that uncertainty?
Yeah, so actually we see consumers coming into these events daily, sometimes a weekly basis. Actually, our numbers are higher than they were last enrollment period, so we still see a lot of excitement from the consumer. And I think events like these help because they have someone to talk to who's a navigator, who's unbiased, who can provide assistance to them and talk them through any questions they have and any confusion. But right now we just want to let people know there is no change to the law. Nothing has changed. They can still enroll until January 31st. And if they enroll on January 31st, they'll have healthcare starting on March 1st.
Let's say that happens. Someone enrolls, gets healthcare starting on March 1st, but either then or before then or soon after that, the law is completely repealed. Do they still have health insurance?
Well, I can't speculate on that just because we don't know. There has been no change. No law has been signed. Nothing has happened that has changed anything for these consumers. So what we're telling people right now is just continue on like everything is the same, because it is. And so come on, enroll, and they should be covered by March 1st.
And the question I'm going to ask may sound to you like a repeat of a question, and maybe you don't have a different answer for it, but how are people's confidence, how are they feeling as far when it comes to the uncertainty? They don't know really what's coming up. Does that make them more or less likely to come and enroll for health insurance?
I'm seeing consumers still come, especially to our events that we've been holding for years now. We're still seeing a steady draw of people, and I think it makes them feel better that they can talk to an unbiased sister about any of these questions and concerns. So yes, there has been people coming up and asking questions about this and expressing concern, but after they're sitting down with someone, they see the benefits and the health plans that they could enroll in. They choose to still enroll in that health plan because it fits the needs for their budget right now, and it just makes the most sense for their family. So they're still doing it, they're still coming out, we're still seeing the numbers in Florida go up in enrollment this year. So
thanks. Those are my own questions.